Good morning, everybody. I prevent amputation. I am from Indian Podiatry Association, IPA, organizing chairman. Today we have a team of doctors to address the chronic problem of diabetic foot ulcers. The team of the doctors are from different domains from Telangana IPA chapter. Now I request the team to address you related to this problem. Thank you.
I prevent amputation. I am a diabetologist. Presently, around 50 crore people are suffering with diabetes across the world, and it is going to increase by 51% by 2045. 47% of people living with diabetes are unaware of their condition. In India, it is around 8 crores. 1 in 10 adults are having diabetes. Prevalence of diabetes in Telangana between 15 years to 49 years is 4.8%. The prevalence of diabetic foot ulcer is around 12%. People with diabetes can develop many foot problems. Even ordinary problems can get worse and lead to serious complications. Risk of developing a foot ulcer by a person with diabetes in lifetime is 25%. 50% of diabetic foot ulcer become infected. They require hospitalization. 20% require amputation. High blood glucose level can damage the nerves and blood supply to foot. Don't worry, we will take care of your diabetes.
Hello everyone, I am a physician and I prevent amputation. Diabetic foot is one of the most common and dreaded complications leading to limb amputations. Hence, early recognition of foot infection is very important. First step in managing foot care in diabetic patients is very simple. Examination of bare foot. I insist all my patients to remove their footwear before entering my room. Keys to prevention are early detection. I recommend you to visit your physician once in 3 months. Have an aggressive control of your blood glucose. Maintain an active lifestyle with at least 2.5 hours of exercise per week. Maintain proper diet, which is low in carbohydrate, low in fat, high in protein and fiber, according to your local cuisine. So don't worry, with these simple steps, you can be aware and take care of your foot. Thank you.
Hi, I prevent amputation. I am a surgeon. There are few indications where surgical management is necessary for diabetic foot. Infection, gangrene, osteomyelitis, some foot deformities like Charcot foot, and when the wound is not healing with conservative line of management. Surgical management is divided into 4 areas as elective surgery, prophylactic surgery, curative surgery, where we keep the wounds open, and emergent surgeries which we perform to arrest the infection. In this way, with surgical strategies, we can get successful healing in shorter duration of time. You don't have to worry. We will take care of your foot.
I prevent amputation. I'm a surgeon. Wound dressings play an important part of diabetic foot management. Ideally, dressings must incorporate all the principles of wound healing, but unfortunately, no single dressing can do such. For example, non-adhesive dressings are simple, inexpensive, and well tolerated. Foam and alginate dressings are good absorbents and effective in highly exudating wounds. Hydrogels facilitate autolysis, whereas iodine and silver-based dressings may aid in the management of wound infections. Most importantly, occlusive dressings should be avoided in all types of infected wounds. Dressings should be guided depending on the characteristics of the wounds, the patient requirement, and the cost factor. So don't worry, we will take care of you and your pocket both.
I prevent amputation. I'm a plastic surgeon specializing into diabetic foot. Diabetic foot is one of the major complications of a diabetic patient. They can present with lots of ulcers, wounds, and inability to walk. If they don't take proper precautions, then there can be infection, and then that can lead into amputation. So if the patient can reach us in apt time, we are here to help them. We are here to help them cover the wounds. We can have various procedures like an orthoplastic procedures can be done, or maybe we can apply vac and then do some skin grafting, or we can use some local flaps like the couple of pictures which are being shown. You can see that the wounds are being covered properly and thoroughly. You can get the patient back on their feet and then again back into functionality. They can get up and then walk. So it's between the doctor and the patient. So we together can prevent amputation. Thank you.
I prevent amputation. Being a vascular surgeon in diabetic foot problems, my main focus is to address the circulation at macrovascular and microvascular levels. It is very important to optimize the circulation up to the microvascular level. This can be achieved by open bypass surgeries and endovascular means. However, a continuous medical management support is necessary to keep the results going on. By optimizing the circulation, we can deliver the oxygenated blood up to the wound bed and the healing potential is maximized. Thank you.
Start. Hi. One primary cause often ignored and inadequate importance given is body weight falling on the wound. As long as body weight falls on the wound, it just fails to heal. Then how? How much time a patient can be confined to bed? So we have a technique called offloading of the wound. In this particular offloading technique, patient can walk, still body weight won't fall on the wound. We have different kinds of plasters, splints, and customized footwear are used for this offloading technique. If wound fails to heal with the above technique, we have something called surgical offloading is recommended. And the foot deformities are corrected by surgery or by operation to offload the body weight. So, why a wound should become part of the body? Approach us, approach our IPA doctors, because we pledge, I prevent amputation. Thank you.